Today's health headlines, what to know about HoLEP for prostate conditions, how fast to expect symptom relief, and how it differs from other procedures for enlarged prostate.
Joining us is Dr. Daniel Kellner, Yale Medicine urologist and associate professor of urology at Yale School of Medicine. Doctor, first of all, thank you so much for your time this morning.
Oh, thank you for having me.
Of course, really interested to learn about HoLEP. What does this stand for and what conditions does it treat?
So HoLEP stands for Holmium Laser Enucleation of Prostate. And what it does is it treats a condition called benign prostatic hyperplasia, or BPH. Now, this is a condition that almost all men will face as they age. The prostate continues to grow throughout someone's life. It's a little gland that's below the bladder, but the urethra travels through it. And as it grows, it squeezes the urethra and it makes it difficult for some men to urinate. So men could experience a slow stream, urinary urgency, frequency. They may wake up a lot at night, and it really affects the quality of life, but it actually could be very dangerous. It can cause urinary retention. It could be a risk factor for making bladder stones, having urinary tract infections, or it could even cause problems with the kidneys if the blockage is very bad.
All right, very interesting. And doctor, how do you know if you qualify for a procedure like this?
So the HoLEP is a procedure which could treat any size prostate. It's really a size independent procedure. The way the procedure is performed, usually it's an outpatient procedure. So patients come to the hospital, we do the procedure, and then they go home most of the time the same day. They do have a catheter usually after the procedure, which sometimes comes out right after surgery, but usually we leave it in overnight. And patients have almost immediate symptom relief. They'll have a much better flow right away. And as weeks go on, they're going to have better outcomes in terms of the urinary urgency and frequency. And they can stop taking their medications right away after these procedures.
Treating an enlarged prostate is nothing new, but would you say, HoLEP may be one of the newer procedures? How is this different from other procedures for enlarged prostate?
So the HoLEP's actually been around since the 1990s. It's actually a procedure that started in New Zealand. I think the United States was just slow to adopt.
Okay.
Yale, New Haven Hospital, we were the first hospital to offer HoLEP. We started doing them in 2019. We've done over 2,500 cases. And the reason it's different, it's complete removal of the inside of the prostate. So what it does is it gives us the best outcomes, the best durability, the shortest hospital stay, less bleeding. And overall, this is a much better procedure than any other procedure. This really is the gold standard of treatment for BPH. And you want to go to a hospital that has a lot of experience, such as Yale, because it's a technically challenging hospital. But we are committed at Yale to perform HoLEP, and it's been a great procedure for our patients.
And just to follow up, doctor, you mentioned how it gets rid of the entire inside of the prostate. So I guess what is the difference there? Obviously, we're talking a less invasive procedure, but what is the difference just getting rid of the entire inside of the prostate versus just taking out the prostate?
So taking out just the inside of the prostate creates a channel where the urine can pass through very easily, and we could do this in a minimally invasive fashion without any incisions. The idea of taking out the entire prostate, that's a much more radical procedure, which is very invasive. That's something that we do for prostate cancer. And again, so the HoLEP is for treating benign disease of the prostate, which is something which is, basically many, many men are going to face.
All right, really great information. Doctor, we thank you for your time today.
Thank you.
Thank you.